Another keto versus cancer study. Let's review it today. Hello, I'm Dr. Sam. This is Dr. Sam's Health, and today I would like to continue talking about the ketogenic diet. I've made quite a few videos about keto in general. I'm trying to review as much literature on it, as much clinical research that is available to me, and today I would like to continue talking about the research that is dedicated to the impact of ketogenic diet on cancer. I've already made one video when I reviewed an article when we were trying to implement ketogenic diet approach to slow down progression of certain cancer. Today I would like to provide you with the quick review of another article of this sort. Before I begin, I would like to make my regular disclaimers, which are, first of all, I'm a medical doctor, but I do not provide any kind of medical advice here on YouTube or on internet in general. Also, I express certain opinions. They are well researched, but they do not necessarily represent the opinions of my governing bodies, my colleges, my universities, my colleagues, my profession in general. I'm a psychiatrist, not an oncologist, by the way, or a nutritionist. And the last thing is I've made quite a few videos about keto, and I've got very mixed feelings about the ketogenic diet. I don't want my videos to be misinterpreted as something that goes against or pro ketogenic diet. In general, I'm cautiously optimistic about this diet, and quite frankly, the rational diet, my approach, is somewhat close to keto, and likely I will make a little pamphlet about the ketogenic version of the rational diet. But I don't want anything that I say to be taken as either like harsh criticism of ketogenic diet or some sort of a promotion of ketogenic diet. So having said that, let's get to the study. The study that I have here today is the study that was recently published in Frontiers in Nutrition, and by recently I mean literally in just a couple of months ago in February 2025. This study explored the use of ketogenic diet in clinical setting for management or as an adjunct method of management of a very serious form of cancer, which is called glioblastoma. This is a very serious form of cancer. Usually people have very low survival rates. It's the cancer of the brain, essentially, and it's usually very hard to work with this kind of cancers, to my understanding, just because literally the cancer is located in the brain. It's very hard to perform surgeries on this kind of cancer, chemotherapy, and so on, because like everything that is applied to the cancer usually affects the person's brain and can lead to multiple adverse effects. I would like to say that today's review will be relatively simple and short. I don't want to make long videos providing lots of technical details, because in my impression, most of the people don't really care about them. What they really care about is like what is the outcome of the study and what is the good interpretation of the results. Having said that, I would like to say that the article is actually well detailed. It's a very thick article, and if you are very interested in some sort of technical details, please take a look, read this article. It's a beautiful article, actually. So what they have done, they have taken 18 subjects, 18 patients with glioblastoma, and offered them to follow ketogenic diet protocol. Some of them managed to stick to ketogenic diet for a longer period of time. Some of them did not stick to ketogenic diet, and they have divided this cohort of 18 patients into two subgroups. Group 1 was the group that managed to stick to ketogenic diet for up to 6 months or more, and another one was 12 patients who did not stick to this diet for that long. One really amazing thing about this study is that the authors provided us with survival data for each and every participant. I must say that this kind of data is actually very hard to work with. They are not completely intuitive, and unless you're doing some sort of survival analysis, it's actually very hard to visualize this data. But for your convenience and for my own sake, I've made a little chart where I track the survival rates of the participants over the course of 3 years, and the authors did something very similar. And you can see that in the group of 6 subjects who were following the ketogenic diet for 6 months or more, only 2 participants died over the course of 3 years, which is a significant improvement of the kind of general survival rate for disease like that. And unfortunately, in the group of individuals who did not follow the ketogenic diet for at least 6 months, the survival rate was way, way less, way, way smaller. Unfortunately, only one person out of 12 survived over the course of 3 years. At this point, the information presented in the study shows a lot of promise for ketogenic diet. But I would like to be this cautious, skeptical, critical person. I would like to say that this study unfortunately doesn't show that ketogenic diet suppresses cancer growth or improves survival rate. What it does show is that individuals who are able to stick to ketogenic diet for whatever reason are much more likely to survive than those who were not able to follow the ketogenic diet. Let me elaborate. I just want to be sure that my message is very, very clear. This is not a randomized controlled trial. They didn't take a group of people, they did not divide it randomly into two conditions. One of them would be ketogenic diet, another one would be something else. They have taken one group of individuals, provided them with the same approach, and during the study, the participants essentially subdivided into two sub-cohorts non-randomly. So there were people who managed to stick to ketogenic diet and people who did not manage to stick to ketogenic diet. And there are lots and lots of reasons for these people not to be able to stick to ketogenic diet. The first one that crosses my mind is the fact that the disease in these 12 individuals progressed so fast that for some reason they were not able to continue with ketogenic diet. It might be done due to medical advice, they might have required much more significant interventions and so on. So there are lots of factors that have played a role into separating individuals into two sub-cohorts, and that is not a randomized controlled trial design. Having said that, I would still like to congratulate with authors who is publishing this kind of research. It is a very important piece of research, and I hope there will be studies that will be performed in the RCT design, randomized controlled trial design. One of the reasons why I'm trying to make this videos is just because I assume that many of you will at a certain point come across somebody who will be claiming that this kind of studies are showing that ketogenic diet cures cancer or helps to suppress progression of cancer. I must say that as a researcher myself, that this kind of study cannot provide you with this kind of information or reassurance. The very different, very specific design study is required, which is randomized controlled trials to show causal relationship really, really well. And also at a certain point, I bet somebody will make a meta-analysis that will include studies like this one, like the one that I have been talking in one of my past videos, and they will show that the survival rates in people who follow ketogenic diet are much, much higher than in people who don't. And again, it might be misinterpreted as ketogenic diet slows down progression of cancer. You are warned. I think that my job is done. Again, I have nothing against ketogenic diet. I'm more on the pro-keto side, but I believe that this kind of research must be interpreted properly and cautiously. And I hope that we'll get more studies of this sort. And I hope there'll be studies that will be done in the RCT kind of design, and we'll be able to actually see the actual answer, whether ketogenic diet helps with cancer significantly or not. Having said that, I think that this video is done. Thank you so much for watching, and I'll see you in my next videos. And meanwhile, check out my book, The Rational Diet. Check out my website, drsamshealth.com. Subscribe to this channel, ask questions. I'm happy to respond to your questions and comments, and looking forward for future interactions. Thank you so much.